China launches a digital vaccine passport for travelers, but the WHO warns that there are ethical concerns. Professor Teo Yik Ying from the Swee Hock School of Public Health joins us live for more on this story. Firstly, support for vaccine passports appears to be growing with backing from China and Europe now.
Well, it's a very attractive idea, especially if we have the data to properly establish that vaccination helps to reduce the risk of infection and transmission. That proof of vaccination then becomes part and parcel of what permits travel. After all, what is stopping us from traveling now at the individual level is really the concern of being infected and subsequently infecting the people around us. At the national level, we've put in place all these border control measures to ensure travelers coming in do not interact with the rest of the community until we are quite sure that they are free from infections and cannot infect others that they interact with. So if we now have data that vaccination actually significantly reduces the risk, both at the individual and at the country level, then proof of vaccination with a digital certification or passport becomes extremely useful to allow travel to happen. But honestly, I think we are still some steps away, and there are certainly operational and ethical concerns in deploying this across the world.
So, you talk about the potential usefulness of such a vaccine passport, but how would it work, taking into account those border restrictions that still exist, the ones you just mentioned?
So I think in the first instance, there must be an agreement between countries on such a travel scheme on which vaccines are approved by the different countries, because right now there are different countries rolling out in their national strategies different vaccines. So there is a need to agree upon such a travel scheme, which kind of vaccines will be recognized. And then there is the need within every country to accredit the clinics or the community centers that are actually performing the vaccination to ensure that there is no fraud. And the vaccination records need to be properly recorded optimally on a digital platform, and whether these platforms can be shared across borders. So operationally and politically, it is not going to be that straightforward to achieve these principles. So what is likely to happen, in my opinion, is that two countries' bilateral agreements will first be established. So countries will come together in pairs to establish the agreements for this to happen. Then other countries will see the benefit and they will align themselves to join this.
And the WHO says there are ethical considerations. Such passports might increase inequalities, they say. What's your take?
Yes, unfortunately, I strongly agree with that as well, because the practice of vaccination passports will further drive inequality in the world, because this ties in with the current concern about the access to vaccine and who are actually the ones that are medically eligible to be vaccinated. Advanced economies are the ones that are likely to acquire enough vaccine doses to inoculate perhaps all 100% of the people who want to be vaccinated within their countries. But the reality is that resource-poor countries will struggle even to achieve the minimum 20% supply to vaccinate the key essential healthcare workers and other high-risk groups such as the elderly. So now if we tie in that opportunities to travel and also for trade to be linked to COVID vaccination, then clearly advanced economies are going to be in a better position than the low and middle income countries. So right now, the supply of vaccine is already limited, and the poorer countries are struggling to get enough access to vaccines to achieve the basic principles of protecting their people. If we introduce the idea of a vaccine passport, it will massively worsen the vaccine inequities that we are seeing. The inequality doesn't just exist in low and middle income countries. Even in the rich advanced economies, it's important to highlight that there will always be a group of people who are medically unsuitable to be vaccinated. And even right now, children are not eligible or suitable to be vaccinated with today's vaccine. So the question is, does that mean that these groups will forever be denied the opportunity to travel?
Professor Teo, do you think there is any possibility that the use of such travel documents might actually increase complacency with regard to the mitigation of the spread of COVID-19?
I do think that it will, because we are starting to see some of this complacency happening in jurisdictions that have a large rollout within their country. Especially if documentations also result in the lifting of public health measures such as mask wearing or some limits to social interactions. And all of this are happening before we truly understand what is the benefit and the impact of vaccination. So right now, there are many layers of measures to protect individuals and communities against widespread outbreak, including strict border control. Can vaccination as a single measure really replace all of these different layers? I think there's still a lot of understanding we need on the science about the benefits of vaccination. So my concern is that there are societies that are rushing into reopening, into the widespread use of such vaccination passports before the science is mature enough. But I hesitate to say that this is complacency, because there are also societies that are desperate enough with the need to reopen. This is potentially dangerous because with new variants emerging all the time, there is a real risk that there will be variants that will emerge that will evade the protective effects of some of the vaccines. And that's when we go back to square one.
Okay, many thanks for speaking to us this evening, Professor. We've been speaking with Professor Teo Yik Ying from the Swee Hock School of Public Health right there.